Well, if we learned anything from Wednesday's inflation print, prices are slowly coming down, but Americans are still dealing with high costs, especially when it comes to healthcare. Biden is looking to help consumers get some relief here this week. The Biden-Harris administration announced new actions to protect consumers and lessen the burden of medical debt on American families. Now, the proposed plan would ban such debt from credit reports. Here to weigh in on what this means for you and your finances, we've got Yahoo Finance health reporter Anjalee Khemlani. Hey, Anj.
Hey, Brad. That's right. So the Consumer Financial Protection Bureau did introduce this new proposal this week, and it is, of course, open to public comment, and we're going to see what the pushback is on that. But the reason why it has been put into the public sphere is because we know that medical debt continues to be a problem. It was a problem pre-ACA and continues to be a problem now, even with the increased use of insurance. You can see on your screen the amount of medical debt, still more than $10,000 on average. Most Americans are facing that amount and are not able to pay it off. It is impacting their credit, therefore. The protections do cut off at some point. There are credit bureaus that don't necessarily report under $500 in debt, or if you pay it off within a year, it doesn't impact your credit score, but there are longer term impacts. And this has a lot to do with, as you can see on your screen, the map of where this debt is. It doesn't necessarily fully match where Medicaid is not expanded, but that has been one of the issues that folks have focused on, is that Medicaid expansion was supposed to help reduce the amount of debt by allowing those that are 138% of the poverty line to also qualify for coverage at the Medicaid level. Meanwhile, we know the Affordable Care Act has also done a lot to help ensure insured Americans, but there is still a lot going on with that. I spoke to a Princeton professor who told me that it's not just the uninsured that are part of this equation. It is also insured individuals that are contributing to this. You can see on your screen there. Meanwhile, we're looking at what this exactly means. So states have already, and some cities as well as counties, have already introduced some rules and new laws that would help pay off this debt. So New Jersey, for example, one of those states that introduced the COVID funding that it received, and in a one-time shot allowed $10 million to pay for approximately $1 billion in medical debt. It would effectively cancel that debt. Then they are targeted so that it's only those who qualify below or at 400% of the poverty level. And as I mentioned, they're using that one-time shot with the funds. Now, it doesn't fully erase the problem. We still see medical debt as an issue in the country, but some states are starting to do this. The Biden administration has encouraged more states to jump on board. We know Connecticut and Arizona are also doing this. And so that is where sort of the crux of the problem is. And so while they can't erase the debt altogether, at least keeping it off the credit reporting and allowing individuals who still face that one-time burden of medical debt to still continue getting homes, getting cars, and getting loans, that is the goal of this rule. So we will definitely wait to see if it becomes a rule.
Yeah, especially when so much medical debt is incurred, not knowing what you're fully paying for as well here. So this slightly addressing that issue as well. Anjalee, while we have you, there's new data out from the Federal Actuaries Project's Medicare enrollment will drive up annual healthcare spending to $7.7 trillion by 2023. Why is Medicare the culprit here?
So Medicare, we remember, that's the older population. So they need more care, they need more drugs. So it's all a part of the package of why prices are going up. This is why Medicare has been so adamant about trying to fight drug costs. And we know that the aging population is also increasing, and that will attribute to that growth. You see on your screen, not just Medicare, but also private health insurance. So that's the commercial population, which we know is funded through employers in large part, will contribute to this. So price of drugs is an issue, as well as the increased growth. We saw a huge spike in healthcare use because of the pandemic, and the increase and the continued use of healthcare services as a result of that. As people got more comfortable, continue to go. There's also telehealth and more ways to access the healthcare system. That is all contributing to the drive up in costs. Right now, the spend, I think, is about 4.8 trillion, and then you're going to see that jump in a few short years.
Wow. Yahoo Finance's own Anjalee Khemlani, thanks so much for breaking this down. Very important personal finance matter for a lot of households out there.